Welcome to Medical Montana. We're here today at Advanced Rehab speaking with Sandra Marston. Sandra, you've been working as a physical therapist for the last 20 years. Tell me a little bit about your facility and your practice.
Advanced Rehab was opened 15 years ago with the philosophy that everything is connected. And what that means is when you come to us as a patient, we take time to understand who you are, what you're about, what's important to you, what are you trying to get back to, how is the pain that you came to us with or the limitation affecting you and your lifestyle. We have to know that so that we can be on the same page in this conversation of getting you better.
How does that translate to care then, knowing that mind, body, spirit, how it all fits together?
It ties in because that's what we're trying to do. We're trying to heal you in a way that, what's your end point? If that is to swim competitively or just to lift your child, if we don't meet what's important to you, then why are you coming, right? So we have to start there, but from there, we then go into the work of figuring out why. What caused this? What is going on? And if it's just, sometimes it's just one little area, like you come in and it's an elbow pain and it's really just an elbow pain. And if it's a new injury, that's likely that it is just that one small place. But if you've come in and you've been like, well, I've been having this pain for years and I just thought it would go away, which we commonly hear, then it's more than likely that the pain started from or is caused by a more distant place. And we have to take the time to look at all the things going on. So if it's at your ankle, we might start at your mid-back on down and make sure that we find all the contributing factors. Because just looking at one body part, we could miss it. Anybody could miss it because you're more than just that ankle. There's a knee attached there, there's a hip attached there. And if that stuff is not moving okay, you're gonna compensate. And usually it's a compensation place that breaks down and that hurts. But it's not always the cause. Yeah, you're more than just this little part. And
so once you determine that cause,
yeah,
and then that pain point, what's those next steps?
Well, then we look at all those factors and you and I have a conversation as to what is it going to take to get you better. And usually there's a hands-on component, there's always an active component. It takes commitment on your part and our part.
Great, thank you, Sandra.
Thanks.